Primary hypoparathyroidism. Extensive calcifications of the basal ganglia are seen. Calcifications of the dentate nuclei were also present, but cannot be recognized in this projection. Fracture and suture diastasis. The sharp and distinct margins of the fracture line projecting into the right orbit and the traumatic separation of the left lambdoid suture, whereas the normal lambdoid suture projecting into the frontal sinus has an indistinct margin and is barely visible. Osteoblastic metastases from breast carcinoma. Round lesions of increased density are particularly well seen in the frontal area. Note also the normal thickness of the skull that helps differentiate this condition from Paget's disease. Incidentally, physiologic occipital thinning presenting as increased radiolucency of the squama occipitalis is also noted. Meningioma. A localized thickening of the inner table is seen, arrows. Plain skull radiograph shows a well-defined solitary lytic lesion in the right frontoparietal region. CT scan with bone window, A, demonstrates a right-sided frontoparietal intradiploic mass expanding the calvaria with cortical destruction. Post-contrast CT scan, B, shows prominent enhancement and intracranial extension of the lesion. Three-dimensional reformatted CT image, C, clearly demonstrates the osteolytic skull lesion. Text. Parallel serpentine calcifications consistent with Sturge-Weber syndrome, arrows.